Hello and welcome to this week She Is Still Dope TV. I am Dr. Robyn White and we are here today discussing Mommy, it's time for your checkup. So thank you for joining today. Again, I'm so happy that this is our week 2 of our episodes, and this week our topic is, have you stopped to pray for yourself? So thank you, everyone. Last week, we enjoyed my mini-me, Raina White. We're going to try to have her on at least once a month. I think she took over the show because that's just the type of personality she has. But today, we want to focus our topic on ourselves, women. We want to focus our conversation on have you stopped to pray for yourself? And the reason why this episode is very important and near and dear to me, because the CEO of She Is Still Dope Society, C.S. Bailey, asked me this question. And when I tell you that it made me stop in my tracks to really evaluate the fact that as a woman, as a mother, as a wife, as a nurse, as a doctor, as a nurse practitioner, there are so many times that I am stopping to pray for other people, but I never ever take the time to stop and pray for myself. And so a lot of times I think it's very important, even in our health journey, that we stop and we take a moment to ask ourselves, have we stopped to pray for ourselves? Have we stopped to take care of ourselves? Have we stopped to drink water, to have an intake with ourselves that allows us to be able to be present, mindful, and very aware of what we need at this point of time? So today's topic, we're going to really check in with ourselves. And so in praying with ourselves, we need to ask ourselves a couple questions. So one, we have to check where we are in our current state. So as the word says, we are constantly going from glory to glory to glory. We are constantly evolving just as creatures. And so we need to always kind of, at different transition points, such as myself, our family is prepared to move across the country. Not just across the country, but to another country. So this is a very high transitional, stressful time period. And so I have to be honest with where I'm at with myself and honest with what I need in this moment. Woman, it is okay to say, I am not okay. And I need to ensure that I am being mindful of what I need in this moment. So today what we're going to do is we're going to do a self-check. And so with that self-check, I'm going to be providing you after the show with a link of kind of a checklist, of kind of a check sheet of things that you should be checking in with yourself. So as I am your doctor, I want to make sure, women, that we are doing the necessary checkups that are very appropriate and are very important to our lives. So how many of you get annual checkups? How many of you check in with your doctor annually to get a baseline of where you're at and a baseline of what your needs may be? How many of you have taken the time to even reach out to maybe a loved one or a friend to ask them what they may need from you at this point of time? How many of you have had your blood pressure checked within the last year? What about checking for diabetes or high cholesterol or high fat or your thyroid? How many of you guys have checked in to see your stress level? And if you are having an inappropriate amount of stress related to life, related to COVID-19, or just related to normal woman situations, such as maybe menopause, or maybe the transitioning of having a baby, such as postpartum depression, or maybe even changes with hormones. That's very important that we do a check-in. So I want to kind of go over some of the most important check-ins that you should be receiving. As we all know that because of COVID-19, we have not been able to get our regular checkups. Many people are waiting to go back to the doctors until after COVID-19 has gone away. And so we're missing some very important checkups that we might want to consider at this time to call our doctors and have checked. So some of the women's health checklists that we want to make sure we're doing are that we're having an annual wellness exam. And with your annual wellness exam, it's a well woman exam you should be getting every single year, which includes a visit that includes a physical exam where they'll check your heart, your thyroid, just all your from head to toe, just a kind of quick checkup. So at that appointment, we may look in your eyes. We may check your heart to make sure there's no murmurs. We may also check your pulse on each side. We'll have you even do take off your clothes or gown up and do a full body check to look for any abnormalities on your skin that may need biopsy or anything that looks different on your body. We'll also, at this check, we'll check for preventative screening. So we'll make sure that you're up to date with all your vaccinations, to include your flu vaccine, depending on your age. Other vaccines are important, such as your TB, that's, in case you get stuck by something, your TB immunization. Also for older women over the age of 60, we recommend the pneumococcal immunization, which helps prevent against pneumonia, and also shingles, the zoster immunization, which helps prevent shingles. So those are some immunizations that you may want to make sure that you're getting. Hopefully they'll be coming up with a coronavirus vaccination here in the next year or so. So that will be another one that we want to definitely get ready for. Also, we want to make sure that we are reviewing healthy habits. So at this time, the doctor will review your diet. They'll get some baseline labs to make sure that your cholesterol, your CBC, make sure you're not anemic. Also, they'll also check and look at your lipid profile, make sure you don't have a fatty liver or your cholesterol is not high, because all of those things can lead to heart attack, stroke, or heart disease. Another important part of your health checkup is your bone health. So making sure that you have strong bones. So bone mineral density is very important. Women reach their maximum bone mass at around the age 30. So basically the bones that you're going to have by the age 30. And so what that also means that bone density starts to decrease after 30. And so you'll start to lose bone after that. So women age 65 and older should have a bone mineral density test at least once in their lifetime. And basically, what does that test do? It'll help us know if you have osteoporosis or if you have thin bones and maybe need supplements to help increase your bones, because the older you get, you're more likely to fall and break a bone, which can be life-threatening then you can get blood clots, and when breaking a bone, you have a hard time healing because your bone density has stopped at age 30. So no matter your age, it's important to keep your bones strong and healthy. So ask your healthcare provider about weight bearing and muscle strengthening exercises that are safe for you. So one way to prevent this bone mineral density is by continuing to do in things that impact your bones, like exercise. So walking every day, making sure you do a little bit of light weight lifting is also very important, because that helps build strong bones. So although you may not be making more bones, we want to keep the bones that we have nice and healthy and strong. Another health check is our breast health. So studies have showed that providers doing breast exams are out of practice because we can't really tell subjectively how your breasts feel, or objectively, I'm sorry. We can't feel as clear if there's any type of deformities, but subjectively, meaning me, I can do monthly breast exams on myself just so that I can know what normal breast tissue feels like. So therefore, when there is an abnormality, I will be able to detect that. So I encourage all women to do monthly self-checks. Usually I tell women to make sure they don't do it during their period. Don't do it before or after. I wouldn't do it before your period, and I would do maybe a week after your period, because our breast tissue changes during our cycle. So how you would do this, you would either do it in a shower, and you would just go all around the full breast and also around the areola and the nipple to make sure that there's no drainage coming out, or there's no lumps bigger than a dime that you can't move, that are fixed. So you want to do those on both breasts. You can also do it lying down with one hand over your head, or you can ask your mate, because sometimes our mates can feel our breasts or feel like, oh, you have a lump there. So monthly breast exam are important, and it's really important at 40 that you start getting a mammogram. So these is recommended annually, starting at the age 40, and it could be earlier if you have a family history of breast cancer, but definitely by the age of 40, you want to start getting your mammograms for breast health. Also, colorectal health. So colonoscopies are definitely important for women. If you're age of 50 or older, you should have a colonoscopy every 10 years. Now, I do want to let you know that there's so many different ways. Many people are fearful of getting a colonoscopy because that's the time that they usually do it. They kind of go up with a scope and they go from the rectum all the way through your colon up, and they can do an upper GI as well. But science have come up with many other ways you can do this test besides the invasive colonoscopy that everybody dreads. And the way you can do it is by giving a fecal sample, meaning a sample of stool, poop, and sending it in and checking for blood. Now, the thing about it is, with that, you would have to do that every year to test to see if there's any blood in any of your fecal contents that would then lead to a colonoscopy. So it depends on how you feel. You get the colonoscopy at 50, it's good. You don't need another one for 10 more years. Or you poop on a little piece of paper every single year, and if something's wrong, you then go and get a colonoscopy. But the definitive and gold standard test to test for any type of colorectal disease will be your colonoscopy. So it's just your preference, okay? Next up is diabetes. So we definitely want to do our diabetes check. There's a blood test called HbA1c, and basically what that is, it's a 3-month history of your blood sugar reading. So I don't know how the test does it, but it gives you an average of what your blood sugar is for 3 months, and based upon that number, if it's 5.8 or greater, you are considered diabetic. And what that means is, depending on how high that number is, would determine if you would need to start insulin, or would you be able to change your diet with just lifestyle changes, meaning diet and exercise. But you definitely want to, at the age of 45, you want to start getting that done every 3 years. Screenings may begin earlier if you have a history or if you're at risk for diabetes, such as being overweight, having high blood pressure, high cholesterol, or a history of gestational diabetes. So for all those women out there, I definitely want to do a foot stomp here. If you had gestational diabetes, meaning you had diabetes when you were pregnant, you are at greater risk of having diabetes after having a child. So you should be getting that diabetic screening at least annually. And then you should monitor for signs and symptoms of diabetes, like thirst, excessive thirst, like unquenchable thirst. No matter how much water you drink, no matter how much you drink, you can't quench your thirst. Maybe you pee a lot, polyuria. Maybe you go to the bathroom all the time, constantly peeing, or you crave sugar a lot, more than usual. Those are some symptoms. Maybe your eyesight gets blurry, you have headaches. So those are symptoms that you may be diabetic and you may want to have that checked. Eye, ear, and dental health. So this is really important. Everyone has an eye exam by the age of 40. Adults should receive a comprehensive eye exam by an ophthalmologist before the age of 40. And if you have a pre-existing eye disease, you may want to get that eye test done sooner. As we get older, we want to have our eyes checked at least every 1 or 2 years for signs of cataract or age-related macular degeneration disease such as glaucoma. We also want to have a hearing test. We'd be surprised, especially if you have a job that exposes you to loud noises, you definitely want to get a hearing test if you have any issues with your hearing. And then dental exams. Dental exams and cleaning should be done at least every 12 months. Sometimes you can do every 6 to 12 months, depending on your insurance, but definitely every year you should be getting a regular dental check. Heart health. Women, you know, February is usually the month of red where we check in with our hearts and making sure we don't have heart disease. Heart disease is the #1 killer for women. So what do we need to make sure we're in good standing with? Blood pressure and cholesterol. Because if our cholesterol is high, it clogs our pores, it clogs our arteries, and it leads to those plaques getting into our arteries, breaking off, and causing a stroke or a heart attack. So we definitely want to make sure our blood pressure is maintained. You can buy a blood pressure cuff off of Amazon. I think every house should have a thermometer, a blood pressure cuff, Tylenol, Motrin, and ginger ale if you're Black, and some castor oil if you're Black, or cod liver oil. You should be taking that every single day. Like that is just your staples that you should have in your house. If you don't have it, get it today. But we definitely want to make sure our blood pressure is being maintained 120 or 80 or less. And for our cholesterol, we want our cholesterol to be 200 or less. So you definitely want to be making sure that you're getting your cholesterol checked every 4 to 6 years, starting at the age of 20, and then every 4 to 6 years if you don't have any underlying conditions. Also, for our young people, we want to make sure that they're getting their heart checks. There's a big increase. One of my beautiful nieces, who I love dearly, Tiffany's daughter, Cherish, she was diagnosed with an enlarged heart, dilated myopathy. And this is something, she was diagnosed with at a very young age. Luckily they caught it, but she ended up needing a heart transplant. So even during our physicals for our children that are in teens, we need to make sure they're doing an EKG. And I would even assist that you get a picture, meaning an x-ray, to look at the heart and the lungs. Okay. Immunizations, we kind of talked about those. Mental and emotional health, it's so important that we check in, guys. I cannot say, I think I say it at least every episode. Our mental health matters. And you can tune in on Wednesdays with our Green Couch therapist. She has excellent information regarding mental health and where we can go to get help if we're struggling with depression, anxiety, PTSD, or even social isolation. So talk to your healthcare provider about any mental health concerns that you have, and make sure, especially with addictions, that's a part of mental health. Addictive behaviors, addiction with sex, addiction with alcohol, addiction with any of those things are really important that you check in with. Oh, sounds like I have a doctor's call. I must answer. 1 second. Okay, so it's definitely important that you check in and you do take care of your mental health needs. And it's really important that you do that as often as possible, okay? Because like I said, when we started this conversation, you have to pray for yourself, but you have to check in with yourself and figure out where you are on that spectrum of being okay and not being okay. So that's really important. And then we want to also check on our reproductive health and our sexual health. Women, I don't think we talk about this enough, but how many of you can testify that the older you get, sometimes our sex drive isn't where it needs to be? Sometimes if we've already entered into menopause, we may have complaints of dryness. We may have complaints of just low libido, meaning low sex drive. And there's help for that. So definitely, if you're experiencing any of those things, don't think that it's abnormal, and make sure that you talk to your doctor about it. Also, we do cervical cancer screening to test our cervix for cancer. We should be doing that starting at the age of 21 is when we get our first pap smear. And then if it's normal, we can go every 3 years. And then at the age of 30, every 5 years. Okay, so that's really important. Also, sexually transmitted diseases, chlamydia and gonorrhea for women are asymptomatic, meaning you won't have any signs of it, and it can lead to infertility. I have that story, and you can tune into my upcoming podcast in the near future to hear about that story of how I dealt with infertility and what was the cause of it. So you definitely want to make sure that you're getting tested. Our recommendations are anyone between the age of 13 and really 64, because we've actually seen an increase in HIV and AIDS in our older population whose husbands may be deceased, and they start having relationships outside of what their spouse was. So we're actually seeing an increase in syphilis, HIV in our older populations. So nannies and grandmoms, make sure you're wearing condoms and make sure you're getting tested for sexually transmitted disease if you're having unprotected sex. Pregnant women should also be screened at the start of their pregnancies for HIV. And then if you're, like I said, again, if you're sexually active and under 25, you should be screened for gonorrhea and chlamydia. And if you're over 25, you can talk to your healthcare provider about which screening you should get. Lastly, I want to talk about skin cancer. So Black people, my Black sister and brother, please know that you can get skin cancer, okay? Although we have the beautiful melanin running in our cells, we are still we are still susceptible to skin cancer. So we want to make sure that we're protecting our skin. We also make sure that we go to our doctors at least once a year and do a full body skin check. If you have anything on your body that is bigger than a dime, that has abnormal edges, that is discolored on one side or the other, maybe like dark on one side, lighter on the other. So it's A, B, C, D is the asymmetry, meaning if it's not symmetrical. B, the borders, if the borders aren't perfectly circular. C, the color, you want to look at the color of it. If it's dark, really, really dark black, if it looks unlike any other area of your body, that's important. You also want to look at the depth, meaning depth and diameter. So if it's raised up off of your skin, that's important. And then you also want to look at the content of it, meaning like, does it look different than any other place on your body? If you have an area, and sometimes we can't see them if we're single, if we don't look at our backs, that's why when you go to the doctor, you want to do a full body skin check and make sure that they're checking for skin cancer. There's a Black girl sunscreen that is very popular. It's a Black-owned company that has children's sunscreen as well as adult sunscreen. I highly recommend that now that we're in the summer months that we're putting sunscreen on. You need to apply it at least 30 minutes before you go to the sun, and then reapply it every hour thereafter. Okay, so protect your skin from the sun's ultraviolet rays. As you know, because of our economy right now and our solar system and our protective layer is diminishing because of the way we're treating our environment, those ultraviolet rays are even more powerful now. So we definitely want to make sure that we're protecting our skin, wearing long sleeves, wearing a hat over top of your head if you're going to be in the sun, and putting on sunscreen. Please, please, please know that skin cancer is affecting our Black communities. So that is your health check. Get healthy, stay healthy. Women, as you pray for yourself, remember that in John, I wanted to read the scripture. Let me just pull it up so I don't misquote the Bible. Of course, now I'm not going to be able to find it. Wait, bear with me. I'm going to say it. I'm going to get it right. Okay, so in 3rd John, the first chapter, second verse, it says, "Beloved, I wish above all things that you may prosper and be in health, even as your soul prospers." So as we're checking on ourselves, let's check in on our health. Let's check in so that we can make sure that not only is our soul being fed, but that we also are remaining in good health. Okay, so until next time, thanks for tuning in. Please like, subscribe, and comment at She Is Still Dope TV. You can also follow me at drrobynwhite.com. I'm also on Facebook, Instagram, Twitter, LinkedIn as your doctor. We're going to be starting follow-up Fridays. So any questions that you may have, know that I may not get to them on this feed, but I will be following up every Friday with you. So ask your questions. Don't feel free, leave comments, leave questions. I'm here for you. As I always say, my motto is, if we can heal the world. All right, bye-bye. Until next time.